5. So let's start. Not getting any audio. Can you hear me?
उसके मेजर कमजोर है एक्चुअली ना
talking about Dr. Saket will keep continue and the session will be increased. Hence, I like to hand over the dice to Dr. VIKAS PANWAR, who is Unit Head and Associate Director, Department of General Surgery and Robotics from Max Healthcare. Dr. VIKAS, handing over to you. Please, Rena, make people aware about today's topic. Thank you, sir. Please, handing over to you.
Thank you for the nice introduction. The audio has some problem, but we'll try to bear it. Let's see. So I hope you can see the slides. Are you able to see the slides? I hope so.
No, sir, not yet.
Not yet? Okay, let me just go back to sharing and see where my phone screen. You can see my slides now? Can you see my slides?
Yeah, now it is visible.
Now it's visible, right? Good. So thank you for the nice introduction. So this is the place where I work, Max Hospital. Basically, we are located at Saket and Panchsheel. And the talk that I'm going to give today is on IBS. So IBS, basically a short form for Irritable Bowel Syndrome. Now, the thing is, IBS becomes a very, very wide spectrum of diseases, you know. So anything that has got to do with the GI symptoms, which are sort of sometimes we call vague. Patient may complain of, you know, gassiness, bloating. They're unable to pass stools properly, sort of constipation. They have to go again and again to pass stools, or sometimes diarrhea. They may be associated with some other symptoms, sometimes even like bleeding in the while passing stools. That may be something different. So per se, when we say irritable bowel syndrome, it is generally a benign problem. It is not a problem that is organic problem, as we say, or structural anatomical problem. So we call irritable bowel disease as a functional disease. There are some certain, other names also associated with the IBS, like we call it mucus colitis, spastic colon, nervous colon, or spastic bowel. So basically what is happening is there is most of the times the symptoms are of basically either a diarrhea or loose motion or constipation. The difference between IBS, which I just sort of introduced, is mild benign symptoms of altered bowel habit with or without bleeding, with a lot of gasiness or distension abdomen. On the other hand, what we have is inflammatory bowel disease. So now this is a very close association of symptoms with IBS, but this is a problem. This is a chemical problem. This is a problem that is a disease. So now basically what is happening in inflammatory bowel diseases, there is inflammation. As we say, inflammation means there is swelling inside the intestine. Obviously, there will be red when we go in and see on a colonoscopy. Patient will have some pain and obviously irritation because of that in the GI system. Again, that will cause a lot of diarrhea, loose motion, or bleeding sometimes. The two most common diseases that come under inflammatory bowel disease in the world are Crohn's disease and ulcerative colitis. So basically, looking at the symptoms first, as I just said, inflammatory bowel disease. What are the most common symptoms that people present with? Pain, abdomen or tummy pain or pain in the belly is one of the most common symptoms. Patient will have generally mild dull aching pain, generally in the lower abdomen. It can be go to the right side or the left side of the colon, depending, sometimes on where the pathology is inside. Central of the abdomen. So small intestine is basically going to give a pain in the umbilical region or the center of the abdomen, as we say. Whereas pain to the right side is more of colon on the ascending side or initial part of the colon. And on the left side, it becomes the latter half or the descending part of the colon. So pain might give us a clue as to which part of the GI system is involved and where the inflammation is basically. Bloating, this is again a sign both for inflammatory bowel disease as well as irritable bowel disease. A lot of patients, normally people, I'm saying because they are not patients. So a lot of time people might say they have bloating, they have very gassy abdomen. And other than that, they may not have anything. So when we say on testing that there is nothing found on testing, that becomes a irritable bowel disease. This is a functional disease. On the other hand, if we find something like Crohn's disease, ulcerative colitis, some ulcers inside or any other pathology, then it generally comes under inflammatory bowel disease. And obviously the overlap of other, cancers like tumors in the intestine, that is obviously there. So all these symptoms can overlap with cancer-like symptoms or cancer symptoms or have patient having cancer, benign or malignant. So the problem is, unless patients are tested most of the times, it is not easy to say whether this is an irritable bowel disease, it's an inflammatory bowel disease, or there is something pathological like cancer inside. So that is the problem because the symptoms can overlap a lot. Diarrhea, constipation as other symptoms, patient passing, blood in stool, these are all symptoms that can happen in all the three basic problems that we are talking. Generally, IBS is a disease of young. Obviously, as we are going to talk about it later, this is related more to stress and other things. So obviously, this is more of a disease in the young. So as I just said, the difference between the diseases, the moment you start having other symptoms than just bloating or gasiness, like blood in stools or dark colored stools, even sometimes black stools, as we say, which is because of melena, bleeding inside the stomach area or around that, that causes black colored stools. So this can be a sign of something more than just IBS or irritable bowel syndrome. This is where we may have something like inflammatory disease or something else that needs to be investigated. If somebody says they are losing weight, they do not have appetite, again, this may be more than IBS. So it may be IBD, that is inflammatory bowel disease, or something more. Fever, again, another sign, which is showing us or telling us there is infection. It may be inflammation. It is mostly a sign of infection. Obviously, inflammatory bowel disease is associated with inflammation of skin, joints, even eyes, iritis. These are all associated collagen diseases with inflammatory bowel disease. Mostly ankylosing spondylitis, which is HLA-B27, is associated with ulcerative colitis. Even iritis is associated with inflammatory bowel disease, and obviously skin diseases like dermatitis. Whereas IBS, as I just said, is more of a benign thing where patient may have more of nausea actually. So what are the causes? What causes these problems? Most of the inflammatory bowel disease, ulcerative colitis, and Crohn's disease, this is a big big chapter to discuss when it comes to cause, because obviously there are multiple causes. It can be hereditary, it is immunogenic, so genetics. So all these things play a very strong role in inflammatory bowel disease. Whereas irritable bowel disease is not very known. Most of the times the causes that are causing IBS, that is irritable bowel syndrome, is basically food, certain kind of food that you eat. That is very, very, most important thing, especially food that is high in carbohydrates, sugars. That is going to cause a lot of bloating, a lot of gasiness. High protein diets, sometimes a lot of these beans that can cause like chanas and rajmas. These can cause very high gasiness, bloating. Stress is one of the most key factors of irritable bowel syndrome. People who have stress or who take stress, many times patients or people come to us and they say they don't have any stress, they don't have any problem, but obviously there is an underlying thing which they are not recognizing, and stress is a very important factor in irritable bowel disease. Infections, obviously you have any routine infections like amoebiasis or milder infections, they can also cause IBS. And obviously hormonal changes, mostly these are age related hormonal changes which can cause IBS like symptoms. On the other hand, IBD, which is the disease, the inflammatory bowel disease, this is immunogenic, as I said. Most of the reason is immune, hereditary, genetics. And what happens is autoimmune disease causing your own smooth muscles of the GI system, irritability, that causes this to have either diarrhea or sometimes constipation. Now, how do we see or decide whether the patient has an irritable bowel or an inflammatory bowel? Now, with this, first and foremost is examination. Physical examination of the patient will tell you a lot of things. With irritable bowel syndrome, generally the signs, there are hardly any signs. Patient may have some gassy distension. If you do a percussion on the abdomen, it will be tympanic, a lot of gas inside. Whereas with a patient who has inflammatory bowel disease will have some inflammatory signs. He might have, or she might have signs of some tenderness, inflammation. Wherever you touch on the abdomen, you might find some tenderness. Patient may in fact come to you with an area where they have pain, and on examination, that area would be tender. That will give you some sign. And even complications of inflammatory bowel disease will give you much more. Sometimes there can be obstruction, there can be abscesses in inflammatory bowel disease, there can be torrid or florid infection. Those will have much higher signs of on examination. Blood test, basically there are a lot of tests that can be done, but basically to exclude, you want to do certain tests which are going to show you infection. That is the most important. Whether there is an increase in TLC count, that is going to tell you whether this is inflammatory disease with some inflammation. Or the other most important to diagnose, there are like diseases like celiac disease. There are blood tests where you can do and confirm these immune tests for celiac disease and the IBS syndromes. Ulcerative colitis, Crohn's disease, well, there are no specific blood tests as such. Stool examination is another important thing which can help. Mostly it will show blood, which is maybe occult blood, which is not known by the patient. Colonoscopy. This is basically a videography of the colon, and this is one of the most important thing to differentiate between irritable bowel disease and inflammatory bowel disease. If a colonoscopy is done and it's showing normal, then this is more likely to be an irritable bowel disease. Whereas ulcerative colitis and Crohn's disease both can be very nicely picked up on colonoscopy. And the advantage of colonoscopy is if you find an area of disease, if you find there is some ulcer, there is some growth, you can do a biopsy. And once you do a biopsy, that will confirm your diagnosis, whether this is something to do with inflammatory bowel disease or a malignancy or a cancer or some other disease. So differentiation of an inflammatory bowel disease from other pathological conditions can be done nicely. Now, CT scan, MRI. These are tests generally reserved when you feel there is a complication of inflammatory bowel disease. There can be abscesses, there can be with ulcerative colitis, there can be narrowing, there can be strictures which can be secondary to these inflammatory bowel disease, which can be picked up on CT scan and MRI. There was something called as virtual colonoscopy, which came up in a big way about a decade back. Not so commonly used, but it can be reserved in certain patients who cannot undergo colonoscopy. Most of the patients who cannot undergo colonoscopy are patients who are phobic about the getting scoped. Other than that, there are very rare reasons, that there is a stricture, there is a narrowing, you cannot go beyond a point. And generally, if the narrowing is in the lower part of the GI system, that is somewhere around the rectum or the anal area, that you cannot evaluate on colonoscopy. Other than that, most patients can undergo colonoscopy. It is a very safe procedure. There are hardly any complications because of that. And it is a quick procedure as an OPD procedure. So most patients, colonoscopy is better. CT or MRI is either for complications or where you cannot do a colonoscopy. Very limited patients would need a CT. For irritable bowel disease, there is a Rome criteria, which has been described. And this is basically seeing symptoms of GI at least 1 day a week for 3 months. So obviously, if you want to label somebody as IBS, it's not just based on one time pain, abdomen, bloating. There has to be at least a period of 3 months. And a patient should feel this again and again. It has to be recurrent. It is not just once in 3 months. Patient should have this feeling of at least once a day that the patient feels there is some bloating, gassiness, pain, abdomen, then you can label this as a IBS. Though, as I said again, we have to see and find that there are no other causes, pathological causes for the problem. Most of these patients obviously have pain, and this pain that we are trying to describe once a week for 3 months is obviously pain can happen during the patient is passing stools, or it can start when the pain starts, the patient wants to go and pass stools. And most of the times the patient doesn't pass anything. So this is called as tenesmus. So patient may have a feeling of tenesmus where they feel like passing stool, there is an urge, there is an irritation, and they keep going again and again and again, and they sometimes pass nothing, or they pass a little amount of stools. And obviously the stools may look different. There can be blood, there can be mucus in the stool. So obviously there may be a change in the color of the stool. Now, as I said, complications of IBD and IBS. So mostly IBS is a benign problem. IBS is not generally a problem that is dangerous. And it may have complications, but these are less likely. As I said in the beginning, these are diseases more related to depression, more related to anxiety, stress. Patient may know about it, patient may not even know about the stress level. So if patient is not undergoing treatment for IBD or IBS, you may find because of lack of absorption, the patient may be dehydrated, patient may have very poor nutrition. Obviously, deficiencies will be there nutritional, like anemia. The patient may have vitamin D deficiency, and obviously the other vitamin deficiencies will cause all skin changes, and sometimes in long term even night blindness can be seen in these patients, because these are the nutritional things that are not getting absorbed. But long term infection, obviously, if there is persistent inflammation in the area, irritability in the area, they may have localized infection, or it can sometimes even cause a florid infection. Blood in stools is going to be because of ulcerations or because of small growth there in the uh, colon. Obstruction is these are symptoms that are now more severe. So if these complications are not tackled, if this treatment is not done, these patients will land up in bigger problems, wherein they can have obstruction, they can have bowel perforation, big dilatation of the intestine. It can be obstruction as primary, or it can be pseudo obstruction because of gases. And obviously with ulcerative colitis, we know that there is a very high risk of cancer. These patients with ulcerative colitis for a long period of time, it has been documented that if ulcerative colitis stays for 20 years, the risk of cancer increases. So colonic cancer is seen higher in these patients. Now, how do we manage these patients? What is the treatment for these patients after you have diagnosed, after you've examined? So how do you treat? So basically, once it comes to treatment in IBS, as it is more of a stress related disease, as it is more of a dietary related disease, obviously diet is going to be one of the crucial things that can help these people, these patients. So dietary fibers, adding more fibers in your diet is going to help. Fibers help because they bind with water, they bind and they soothe in the internal lining of the colon. So dietary fibers, either just by adding, taking more fruits or salads or high green leafy vegetables alone, or supplements, though we don't recommend supplements on from the day go or from the first go, because even supplements may have some preservatives sometimes which may not be good in the long term. So one should stick to more natural fibers, dietary fibers, than to go for supplements and supplementary fibers. Lactose is a very common thing. Again, a lot of myths about lactose. Though a lot of patients will have lactose intolerance. Again, IBS is very commonly associated with lactose intolerance. A lot of people who drink milk or have dairy products will say they suddenly become gassy, they have diarrhea, they have sometimes constipation. So GI symptoms do aggravate with too much of milk. See, these things, obviously, all these dietary precautions will not be harmful for everybody. So one has to be very clear. So IBS is basically a hypersensitivity. Not everybody is hypersensitive. So why is that hypersensitivity? That may be because of the GI problem locally, or maybe centrally, like as I said, stress and other things. So not that everybody should stop eating, taking milk, avoiding milk. This is only for reserved for people who are lactose intolerant, who have IBS symptoms, and not everybody is hypersensitive. So that is very important to understand that many a times everybody starts thinking that milk or milk products are bad for them, and everybody stops them. No, it's not for everyone. It's only for people who have IBS. Avoiding food that will increase bloating and gassy. Obviously, everybody is different. Everybody's level is different. Some people have, gassiness or bloating sensation after eating some very high proteins like, the beans, like the chanas and the rajmas. Or somebody has very high bloating gassiness with sugars. They say they eat sweets and they suddenly become very gassy. So everybody will be different in sensitivity level. So whatever suits a person individually, they should look at those things. So whatever goes for me may not go for XYZ. So it may be restricted to only individual to individual. So it cannot be a blanket cover dietary precautions for everybody. One has to very tailor make it for an individual so that you exactly know what helps them, what doesn't. Water and fluids, obviously, since the absorption of water and fluid is not good, so they should add more plenty of water in their diet. Caffeine obviously causes intestinal hurrying. Legumes, as I just said, beans, they cause intestinal hurrying and a lot of gasiness. So this should be avoided. Avoid FODMAPs is a very common abbreviation used, which are fermentable oligosaccharides, basically sugars. These are all fermentable carbohydrates, which may be oligo, di, or mono, or polyol. So carbohydrates are considered to be the key culprit in IBS. When it comes to inflammation, is obviously inflammatory bowel disease is a pathological problem. And when you find patients with Crohn's disease, ulcerative colitis, medical treatment obviously becomes the first line of choice. There are aminosalicylates, which are to be sulfasalazine and related drugs, which come as both enemas or as oral preparations. And there are certain steroids and other things which can be given as injectable for these patients. Steroid has an important role because obviously it suppresses the immune system. This is hypersensitivity. This is immune system hyper reaction, both the IBS and the IBD. So steroid plays an important role in managing these patients. Immune modulators are available, biological therapies, and obviously antibiotics if there is a risk of infection or there is infection. Then obviously irritable bowel syndrome is more of a stress related problem. This trying to decrease stress is going to be important in management. Relaxation, whether it is like stress management, acupunctures, hypnotherapies, relaxation trainings, whatever helps an individual. Some people just get helped with simple things like yoga, just by meditation, whatever helps. Again, these things will help relieve your irritable bowel syndrome patients. Probiotics and psychological counseling is another thing. Surgery is reserved only for these last four things, where there is a complication in terms of infection, which has become very bad. There is an abscess and which needs to be treated. There is active bleeding from the GI. The bleeding can be very torrential sometimes because of the ulcers inside, GI ulcers, and that may require surgery. So bleeding, bowel obstruction, perforation, these are reasons where the patient may need a surgery, because these are complications of the complication. Like IBS going on to IBD, they are totally unrelated in terms of there is no progression from one to the other. But IBD can progress to cancer. That is what we know. And this is where surgical treatment again can be required. So thank you. I just wind up here, and I think just to give you an overview, and we would like to take up questions individually. Thank you.
Thank you, Dr. Sab. I hope I'm audible right now. Hello?
Yes, you are audible to me. At least.
Okay. So thanks a lot, Dr. VIKAS, for your valuable slide and knowledge about the bowel syndrome. So here we are open for the question. Anybody is having question, they can put in the chat box. We already having two questions. One is from, I think both are from Mr. Dilip Kumar Chatwal. The question number one says, can it diagnose with the ddPCR in place of tissue biopsy?
Can we diagnose with what? Sorry?
Mr. Dilip, you can unmute your mic and ask the question directly.
Biopsy instead of biopsy, what is it?
ddPCR. ddPCR. You can check in the chat box as well, sir.
See, as I just said, you have to. This is reserved only for specific cases, Cancer, you cannot diagnose unless you have a biopsy. I said biopsy is reserved where you want to know the pathological diagnosis. If you are clinically, your suspicion is celiac disease, obviously you want to do blood test. You want to do immune tests for celiac disease. So biopsy is reserved only when you do a colonoscopy, you find some ulcers and you want to take a biopsy so that you can differentiate between, mostly when you do biopsy, one, you want to confirm a IBD, inflammatory bowel disease, Crohn's disease, ulcerative colitis, that you will confirm, or cancer. It's basically ruling out cancer rather than confirming cancer unless it is very evidently visible on colonoscopy that this looks like a cancer. So other than that, yes, there are lots of blood tests, and those blood tests will give you some specific diagnosis as celiac disease, as irritable bowel disease, as non-celiac disease, malabsorption syndromes. So all that can be done with a blood test, should be done with a blood test. So that is right.
Hello, is it audible?
Yeah, I can
Mr.
hear you.
Dilip, it is audible, please.
My question was this: did he meant for the?
No, we lost your voice somehow, sorry. I cannot hear you.
Mr. Dilip, you lost your voice. Mr. Dilip, let's move to the next question till the time mic gets settled. Is the same question? The question is from again from Mr. Dilip, and that is gluten food will help in treating the irritable bowel. So it is a question or answer. It is a little bit confusing.
I think this is definitely this is one of the biggest observations that has been done in the recent past, where gluten-free diet or gluten diet has been shown to increase celiac disease, which is a IBS, and the gluten-free diet has shown to be a major role in preventing this. So the data almost in the Western data shows almost like 8% of the population, 8% of the population has gluten allergy. So in India, we don't have any numbers as of now, but probably we see a lot of people who have allergy to gluten, which is one of the commonest seen in wheat. So wheat-free diet, gluten-free diet, there are a lot of these diets which are being tried and they have shown good results. So when you're talking about celiac disease per se, then yes, gluten-free diet will help. Diet has a very important role in irritable bowel disease. Yes. Any other question?
I hope there is no other question. So your presentation was very detailed. So I hope all the queries have been resolved. So thanks a lot, Dr. Saab.
Yeah.
Thanks you very much, Dr. Vikas, for getting the time and giving the detailed presentation of that. If anybody have any question, they can be in touch with the Max team, or they can touch with us and we can connect with the Dr. Vikas for any detail. He sits in Saket Hospital, Max Hospital, Saket. So you can visit him there as well. And I hope by this we can just wind up this session. Thanks a lot, sir, for your great presentation.
Thank you. Thank you.
Thanks everyone to join the session. Thank you.